I am Xavier Whitford, the founder and executive director of the Tommy Corral Memorial Foundation. Mental health first aid training is important to me because I know the importance of needing to know the signs and symptoms when somebody might be struggling. Mental health first aid teaches you how to recognize the signs and symptoms, how to approach somebody, how to talk with them, and how to refer them and give them reassurance. So some of the key messages for mental health first aid is early intervention. The earlier you can connect with somebody who's struggling and be able to provide them the care and get them the support and help that they need, the less likely it is that it will turn into a crisis. Another key to mental health first aid is reducing stigma and being able to destigmatize the idea of mental health. We all can struggle with it, and 1 in 5 people can struggle with a mental health disorder in their lifetime. Everyone's going to be dealing with someone who might be struggling with mental health in the workplace, and we want to be able to have that be an open conversation, have them to get the help and the care that they need, and be able to prioritize their mental health even in the workplace. Doing so can help create productivity in the workplace, reduce time off if they're able to talk about it and share what they're going through and get the help early on.
My name is Christine Fabiani. I'm an investigator with the Rockford Police Department, and I'm currently assigned to the Crisis Co-Response Team, or CCRT, and I'm also a mental health first aid instructor. I'm newly certified in teaching mental health first aid. I am certified in both adult mental health first aid as well as public safety. Public safety means police officers, security guards, and others within that sector. Being certified to teach mental health first aid in these fields has shown me that people are wanting to learn about mental health, and they're receptive to understanding what someone might be going through, as well as how they can help that person who's experiencing mental health challenges. I also just taught this class for the first time to our incoming recruit class. I think this is being more recognized and embraced by not only the community, but first responders as well. But I think bringing it to the police department and making it part of their post-academy training is a huge accomplishment for mental health first aid. From what I understand, it seems like it's been kind of a difficult process to get into the public safety sector. And with me being in CCRT and not only taking the course, but getting certified to instruct has helped tremendously and actually gotten it into the police department so we can expand from there. I think that the recruits that I recently taught this to got a lot out of the class, whether it be a better understanding of mental health or just being able to change how they have a conversation around mental health, whether it be with their own mental health, their own family members, or dealing with a family on the street. Especially when I teach mental health first aid for public safety, I can relate to them. We are going to run into the same people. We have repeat people who go through mental health challenges. I think giving examples and real life experience really helps them understand. Because I was also a corrections officer before I was a patrol officer, I think these examples that I bring help the students understand how severe these mental health challenges can get and what not getting help can turn into. It correlates well because in mental health first aid, we teach the signs and symptoms of different challenges and what the different signs and symptoms from early on all the way through crisis. We all go through mental health challenges, maybe not diagnosed with a mental health disorder, but we still go through different challenges mentally. And I think learning about them and talking about them will just help more and more break that stigma behind mental health and recognize that even you might be going through a mental health challenge or something that's bothering you mentally and maybe you didn't realize it. Getting help can change your life. I think it's amazing to see people so interested in this topic. I love being able to teach people something new. Sometimes I forget that mental health is not just a common knowledge topic. So I think it's amazing that people are still wanting to learn more and coming to us and really craving knowledge and wanting to help either their friends and family or people in their community. Every time CCRT gives a presentation to the public, I bring up mental health first aid, I give out my contact information, I say, reach out to me if you want to take a class, and then we can get that coordinated. We'll also continue to teach our new recruits in the near future, and then eventually we're working on getting all of our current officers trained in mental health first aid as well. So the whole Rockford Police Department should be trained in it. I have also had interest from the County Sheriff's Department for corrections to teach their corrections officers. I'm glad I've been able to partner with the TCMF Mental Health First Aid team of instructors. Each class requires 2 instructors, And without all of their efforts and collaboration, this wouldn't be possible.
Hi, I'm Elisha Merritt. I am a certified clinical trauma psychotherapist, and I work also as a mental health first aid instructor. I work at OSF Strive Trauma Recovery Center and partner with the Tommy Corral Memorial Foundation. We provide mental health first aid classes to Winnebago County. I am grateful to have the experience of providing direct mental health patient care, and TCMF has the quality community support and guidance through their organization. Together, we're able to provide reliable and consistent mental health prevention education. That empowers individuals to use the skills not only to help themselves, but also to assist anyone who may come across a mental health challenge. I'm amazed that every time we teach these classes, not only did they learn so much from the research-based curriculum, but the added insight and specific examples provided by the instructors solidified their understanding of how to apply their new skill set to their daily lives. I'm able to provide professional insight to educate the community from a clinical trauma lens. A lot of people don't have that opportunity, and it's not spoken about, it's not given space to give presentation. So I really appreciate that opportunity to be able to share that space. Being a clinical trauma psychotherapist, I have direct experience from many relatable situations within our community. A lot of people have struggled with similar situations that I've had direct care with, but we don't talk about it. And so I'm able to provide the opportunity to lots of people during these classes for us to appropriately make space to have difficult conversations and destigmatize the need to get assistance and work through it all. I am grateful to have the opportunity to work with people from all different backgrounds, help them gain insight to help anyone going through a mental health challenge. They become equipped with the opportunity to make space and have conversations, reduce the stigma for mental health challenges. Thus, our community is able to get the care that they need and then get back to enjoying life more quickly. We all have feelings, emotions, sensations. We don't always understand what to do with them. Teaching this curriculum helps us all have a better understanding of how to work through it all and even support each other through it. The more we reduce the stigma and help early on, then we have the opportunity to hopefully prevent it from worsening or even save a life. We have been able to provide many mental health first aid classes in our community and are able to train new instructors to expand providing more classes all around Winnebago County. We continue to get more and more requests over the last year. So our community is ready to learn more, and we're excited to provide that care.
Tommy Corral Memorial Foundation is dedicated to empowering our community by providing comprehensive mental health first aid instruction to businesses, individuals, and organizations in our community. Our goal is to get every single person in Winnebago County trained in mental health first aid. And thanks to the Winnebago County Community Mental Health Board funding this grant for us to be able to do that with the half-cent sales tax, we've been able to start doing so. During our last grant cycle, we were able to train over 230 individuals in mental health first aid. That's made up of multiple categories. Some were through public safety, some were adult class, some were youth class. That's a great start to our goal in this last year, getting 230 people. We also were able to add 4 new instructors in the last grant cycle, and that's helping us create more availability so that we can do more trainings in this next year. We definitely want to thank Winnebago County Community Mental Health Board for granting us these funds for this great project that we're working on, and we're thankful for the collaboration of other organizations like the Rockford Police CCRT team, as well as OSF Trauma Care. We definitely could not do it by ourselves. There's a lot of other people that are wanting to partner with us. We've been able to train many individuals with the city of Rockford. We've trained individuals from other organizations that are funded through the Winnebago County Mental Health Board as well. And we're just happy to be a part of training our community to reduce stigma and to be more empathetic and compassionate for those who are dealing with mental health situations.